Bishop from the Center for Science and the Public Interest. I'm just going to give people a minute to sign on, and then we will go ahead and get started. So again, this is Katie Bishop from the Center for Science and the Public Interest. I'm joined by Julie Ralston-Aoki from the Public Health Law Center, and Ashley Bell from the American Heart Association will be joining us soon. As you all know, this is the networking calls that we've put together to talk about food service guidelines or procurement, whichever term you're using. And today on the call, we'd like to focus on the financial implications of healthy vending and other healthy food procurement policies. That's always the pushback that we hear from vendors, so we just wanted to address the topic. Today we will have two different speakers, Mary McFadden from Broome County, New York, who I'll introduce a little bit more in a minute, and then also Marianne Mason, who was the PI for a study of the Chicago Healthy Vending Policy. So just to start off, a couple of housekeeping things. One is that after the two speakers have done their presentations, we're going to open the lines up so that people can ask them questions directly. So because of that, we ask that you either mute your phone line or mute your computer microphone so that when we do open up the lines, we don't hear any background noise or the siren that's going by your work or whatever that is. So to mute your phone line, you can go ahead and press *6, or else on your computer you can just go ahead and mute your microphone. And the one other housekeeping thing that we wanted to mention is that we have started a listserv to go along with these calls so that we can all stay connected in between calls since they are only going to be quarterly. And this is a great way for people to send updates on what they're working on, ask questions to the group. If you have a question about vendors in New York or something like that, you could go ahead and ask that to the group. You could also share resources, challenges, successes that you're having. So we think that this will be a really great tool for us all to stay connected in between these calls. There haven't been many emails so far, so if you did receive an invitation from me and accept that, you probably are on the listserv. But if you haven't reached out to me, then please do so, and I will get you on that listserv. We're hoping to get people to start using it more, and we're also going to start sending out important updates on that too. So without further ado, I want to introduce our first speaker, Mary McFadden, who is a supervising public health educator for Broome County Health Department in New York. She began working as a in the Women, Infants, and Children program, where she was instrumental in developing Broome County's breastfeeding peer counseling program and was responsible for initiating the Southern Tier Breastfeeding Coalition. Currently, her duties include managing several New York State Department of Health and Centers for Disease Control and Prevention, chronic disease risk reduction programs. At this time, Mary is coordinating a Falls Prevention for Older Adults grant and a comprehensive cancer prevention pilot grant, where she has developed expertise in the field of food procurement policy work. Along with serving on many local health initiatives and boards, she is a member of the New York State Obesity Advisory Group, designing a strong and healthy New York, New York. So without further ado, I'm going to turn it over to Mary.
Thank you, Katie. I'd like to thank you and the Center for Science and Public Interest for this opportunity to present on our experience with healthy food procurement in Broome County and provide an overview of how we started and where we're at, and maybe some pointers on some of our challenges and successes for overcoming them. Just a little snapshot of Broome County. We're located in the southern tier of New York State. We have a population of about 200,000 people. We are the carousel capital of the world. It's a great name for us. We are also in the 1,000-mile terrain of the Appalachia Trail, which extends all the way down to Georgia and has been noted for having higher than normal or disproportionate rates of poverty and chronic diseases and poor health. So we were really trying to get out of that. And with that comes 25% of our children living below the poverty level, which is higher than both the state and the national averages. We are predominantly white. We have a higher than state and national obesity for both our adult and youth demographics. And we have significant racial health disparities. High premature death rates from all cardiovascular diseases. And since our last community health assessment, we've noted that we have gone up in poverty for adults by 4%. So we're really trying to get out of the poverty and chronic disease burden at this point. We have a great opportunity to do that. We have been working with the New York State Department of Health on several chronic disease initiatives funded by the state and the Center for Disease Control. We've worked in schools on food procurement. We have 15 school districts that have a consolidated food procurement system that's allowed them to purchase higher quality food using and harnessing their purchasing power. So that's kind of where our experience began, probably about 10 years ago. So currently we have the opportunity from the New York State Department of Health Comprehensive Cancer Prevention Pilot Program that is working to prevent cancers through the adoption of procurement standards, better nutrition. We know that 1/3 of all cancer deaths could be prevented because of better nutrition. Key partners have been our success through all of these initiatives. We were able to get buy-in from our county executive, who was able to adopt the food procurement policy in Broome County. Obviously, our public health director. We've had experience working with our Office for Aging. We tried to get as many institutional leaders on board as possible who purvey a large amount of food. And can't forget having agencies at the table that represent people living with disabilities. The New York State Food Policy Council provided a report and recommendation on food procurement standards for government entities using the dietary guidelines set forth in 2010. And this really propelled us to use existing food dollars for a more nutritious food environment and a better quality, better nutrition integrity of the food that we serve priority populations. So we say it's putting our money where our mouth is. Experience came from, we talked about the school food procurement. We also had a sodium reduction initiative where our senior meals were reduced in sodium significantly, both the meals and the Wheels on Meals, which they were meals provided to people who were homebound, and the congregate meals. And these were kind of the lessons learned from that. The stealth health approach was always the best in terms of trying to change food and do it in a very gradual way with sodium reduction. Again, gaining buy-in from our key decision makers. We used a lot of cross-pollination from our food service partners in the school districts, and working directly with vendors we felt was really critical in terms of the food procurement standards that we were doing for our government entity, because they're the ones who we want to give the message to. We have to build the demand for the better products so that there's a competitive market. The other population we wanted to ensure we had at the table while we were doing this is the priority populations we're serving. So we did a senior taste testing. We had over 1,000 seniors that were participating in it and provided their input on vendors' products. So we had vendors at the table. We had the priority populations testing their foods, finding out what they preferred, because we want to invest, financially invest in foods that they're going to eat. This is an example of the senior meals menu that we were able to change, and it only required some real basic changes. If you were to adopt 2 soup bases or 2 tomato products, this can really make several different menu changes on the menu. So that's exactly what they did. They started out small, so the financial impact would be lower, changing soup bases and tomato products, and then going from there. These were the 5 key steps we took in our food policy procurement initiation. We assessed the food environment. We had a survey done with the top 10 food purveyors in Broome County to determine, what they served, what they purchased, what they distributed, how they felt about food procurement policies. And believe it or not, none of them said that cost of the products they determined to be an issue. It was the cost of operational expenses that came to mind. We identified a champion, and this was our Broome County executive, and she really set the foundation for changing policy in the county municipality, and then provided some leverage for us going out into the community and gaining buy-in from community organizations. Our Central Foods office serves approximately almost 2 million meals annually. We service the nursing home, the jail, the senior centers, and some children's daycare centers, so we are serving very high, vulnerable priority populations. The other 2 organizations that adopted policy when we did were the Meals on Wheels of Western Broome operation and the YMCA of Broome County, which provides child care meals. We felt doing a promotion and a communication campaign was critical to get the acknowledgement of the community. Now, the New York State Department of Health was very helpful in providing a New York opinion poll where they surveyed New Yorkers and found that at least 70% of New Yorkers agreed with institutions such as government entities like nursing homes, hospitals, or jails adopting nutrition standards or food procurement policies. So we know we have the vote of the general public. This was done after we had done our policy, but it really is building the demand for everybody else to jump on board as well. Katie, do you want to do the news clip that we have? Our county executive is very, very supportive, and a reporter asked her. I'll let you go through first.
Oh, Mary, it looks like the sound isn't working.
Okay.
That's okay. So when we send this out to folks, they can go ahead and click that and watch.
No problem.
Link there.
We did a press conference, and every single news organization that we work with was in attendance. And one of the reporters had asked our county executive the question, well, is this going to cost more money? And she said, of course it's going to cost more money. But in the long run, if you're decreasing the cancer deaths and the cancer cases in our community, that in itself and the healthcare costs associated will save us money. So we were very fortunate to gain her buy-in and acknowledgement of the return on investment for this important policy change. Some of the challenges we experienced in the beginning was the healthier alternatives were harder to find. Again, building the demand takes time. So if you're just asking for a couple things like the soup bases or the tomato products, which a lot of vendors are more apt to have at this point, and infusing them gradually into your budget, that was feasible for us. The Meals on Wheels of Western Broome, they have a lot of specific dietary needs for their patients. So, and the other thing is they didn't write down the recipes. So that really, writing down the recipes kind of put them in a better place so that they could look at the food standards and what they required for these special diets. So what we found to be helpful was phasing in the approach for the new products that met the standards over several different grocery bid periods. We adopted the policy back in April of 2013, so it's almost been 2 years, but it's been a very, very gradual approach. And again, this helps financially introduce the policy of food procurement and nutrition standards. At this point in time, we started out implementing 1/3 of the grocery bid at a time. At this point in time, they have the list of all of the products on every grocery bid that they do, and trying to find out if the vendors are going to give the right products, because that's part of the challenge, is making sure that they're educated enough to make sure that they're following the standards we're requesting. We just got 2 new people on board here, organizations, and one was a Broome County Council of Churches mobile chow bus, which is a community hunger outreach warehouse. It's like a food pantry, and we're trying to really increase the opportunity there for better nutrition, as you know, because it serves such vulnerable populations, and our All Saints Catholic Elementary School. These were our successful implementation strategies. Using educational tools such as this, we had one made for elected officials. We had one made specifically for senior populations and for the school population, so that we could work with other entities in teaching them about what food procurement actually was. Remember, I talked about conducting the food procurement assessment, really to find out where people are at, where they need help, where their concerns are, and then you can better educate them on how to go about adopting the policy that would meet with their needs. Engagement, priority population we talked about. If you can afford a little bit of seed money, we offered our people $2,000 approximately to do this, to get things going, to hire somebody if they needed to look at the current bid process and the products and match them up with the standards that they were going to be implementing, using local champions, and then having recognition events to recognize their efforts. Policy adoption process, we want to make sure that you have your leadership at the table, used in a phased-in approach with them, and that you kind of hold their hand through the initial stages of it so that they're comfortable with the implementation process. The communication plan I talked about earlier, we have an example of. We have partners who've done op-eds, we've done news releases, we've done press events, social media, and have different partners responding to this issue over the course of each year. Again, to sum it up, the challenges have been the level of knowledge of food procurement in our community. People don't really understand what it's about, so we're trying to teach them. Educating vendors, the availability of products, again, the cost, and the acceptability of those products. So to achieve sustainability, you have to look at it at the organizational level, at the institutional standard level, and then making sure that everything is centralized so that the process flows smoothly, and really gaining that larger commitment of sustainability to provide the nutritious foods to the priority populations. We've done some journal articles on our experience with the sodium reduction and the school food procurement model. So I would have you take advantage of reading those if you'd like to learn more. And these are just a list of all the lessons learned that I've kind of gone through throughout the presentation. The one I didn't talk about was obtaining a nutritional analysis software. The schools use a software product called NutriKids. We use a product called Seaboard, and there's other products out there that help institutions to identify the products that they need and then who sells them at what cost. So it's very helpful to have some type of nutrition analysis software to build in the policy infrastructure. And lastly, I'd like to just leave you with a quote. Far and away, the best prize that life has to offer is the chance to work hard at work worth doing, and this is absolutely work worth doing. Katie, I thank you for this opportunity.
Thank you, Mary. And everyone, here's Mary's contact information, and we will send out the slides to everyone afterwards so you can read those closely. And just as a reminder, after Mary Ann speaks, we are going to open up the lines to everyone to have some discussion. So if you are on your phone, if you could just press *6 so that when we unmute you, we don't hear your background noise, or mute the microphone on your computer. And then Julie, do you want to go ahead and introduce Mary Ann?
Sure. Thank you, Katie. I'm Julie Ralston-Aoki from the Public Health Law Center, and it is my privilege to introduce our next speaker, who is Mary Ann Mason. She is an assistant research professor in the Department of Pediatrics at Northwestern University's Feinberg School of Medicine. Dr. Mason is the Community and Evaluation Research Director of the Consortium to Lower Obesity in Chicago Children, or known as CLOC, at the Ann and Robert H. Lurie Children's Hospital of Chicago. Dr. Mason also serves as Community Faculty Liaison for Research with Northwestern University's Alliance for Research in Chicago Communities, also called ARCC, a program of Northwestern University's Clinical and Translational Science Institute. Dr. Mason received her PhD in sociology from Loyola University of Chicago, and her areas of research include child health and well-being, community-engaged research, and injury and violence prevention. And this afternoon, she is going to share with us some of her experience and findings as a principal investigator of an evaluation study of the Chicago Park District's Healthy Vending Initiative. Thank you, Dr. Mason, for joining us today.
Well, thank you for having me. I appreciate this opportunity to talk about this work. I also want to mention that many of the things I'll talk about today were published in an article in Preventing Chronic Disease that came out in August of this year. So people might want to look into that after we're done speaking. Okay. So as noted, I'll be talking about our healthy snack vending evaluation. Oops, sorry. So I want to, in order for you to understand the information, I will explain the Chicago Park District's Healthier Snack Vending Initiative, and I'll tell you a little bit about the methods we use to evaluate it, and then I will share the findings and recommendations that came out of that work. Okay. So a little bit of background information. Again, this project is located within the Chicago Park District, which is the largest urban park system in the United States. It has over 8,000 acres of parkland and nearly 600 parks and over 250 buildings in the parks. 60% of its programs serve youth, so it's a very youth-focused park district. And in terms of vending as it applies to this particular project, the good thing about the Chicago Park District is even though it's a very large district, there is one contract that covers all the snack vending machines in the parks. And I'll just note, snack vending and beverage vending are dealt with separately in the contracting process in the park district. So what I'm talking about today is snack vending only. And also, just to let you know, even though there are 583 parks and 260 field houses in the Chicago Park District, vending machines are only in park buildings, in field houses, and only in some of those field houses. Okay, and there are no field houses with more than one vending machine. Okay, so that's the Chicago Park District context. Then a little bit about healthy vending. So healthy vending is an Institute of Medicine recommended strategy for obesity prevention, and there has been a bit of research on this that shows healthier vending items can improve diet quality, which is, of course, an important outcome. But there has been a lack of research evidence on the cost implications of moving toward healthier vending. And at the same time, there's been a growing awareness among vending contractors about opportunities for healthy vending. And a number of models have evolved within vending contractor businesses where they're doing healthy vending packages. They're different. They differ by vendor, and they're available in some places but not all places. So this work I'm talking about here today really speaks to the lack of research evidence on cost implications. And we try to get at that through this work. So a little bit more about the Healthier Snack Vending Initiative. First of all, I just want to note it's healthier snack vending because we realize even though the items in the snack vending are improved, we can always become healthier. So the Snack Vending Initiative happens via contract as opposed to policy. And that's important because there's a sort of end period to that contract, right? So it means we have to revisit things periodically. The Healthier Snack Vending Initiative at the Chicago Park District happened through a 5-year contract period. So we are 1 year away from the end of the contract period. But we have every indication the contract terms will be renewed. And what this healthy snack vending contract language does is it enables fines for noncompliance. It requires the contractor to provide the park district with monthly sales data so they can monitor how sales are going. It stipulated that all items were priced evenly at $1. Now that has changed since we did the study, but when we did the study, all items in the snack vending machines were priced at $1. And it required that all items in all machines follow specific nutrition standards. And I want to emphasize that this is an area where the Healthier Snack Vending Initiative is a little different. It's all items, 100% in all machines. So many vending policies cover, a mix of 75% healthier and 25% regular fare type of thing. But this is all healthy. Okay. So here are the nutrition standards that are in the contract language. And these stipulate what can go in the machine. So no more than 250 calories per serving. No more than 42 grams of added sweetener per 20 ounces, no more than 35% of calories from fat, no more than 10% of calories from saturated fat, no more than 35% of total weight from sugar and caloric sweeteners, no more than 400 milligrams of sodium per serving, and a limit of 2 servings per package. And then there are other guidelines like no trans fats are allowed, and there have to be at least 5 items that are lower sodium. These nutrition guidelines were based on the dietary guidelines for Americans, as well as some of the standards put forward in FitPick, which is a vending industry standard. And they were developed by a nutritionist within the Chicago Park District. Okay. So here's a picture of what a healthier snack vending machine looks like in our Chicago parks. The things you'll notice are that there are chips in there, but they're baked chips. They're not the traditional chips. That there are kind of sweets and baked goods, but they're in 100-calorie packs, so they're limiting the amount in there. Nuts are allowed. They're a higher calorie item, but they have nutritional components that are that make the cut. And you'll notice, importantly, there's no candy in the machine. And that relates, of course, to the restrictions on sugar. Okay. So I want to talk a little bit about how we evaluated this initiative. Our approach was community engaged in that we had a full partnership with the Chicago Park District, who participated in this, as well as the Healthy Kids, Healthy Communities project here in Chicago, which was led by a staff member from the Logan Square Neighborhood Association. And then, of course, CLOC was a partner. And the evaluation had a number of elements. We did park patron surveys to look into how the healthy snacks were received. We did park staff interviews, again, to look at how the healthy snacks were received. We looked at who was purchasing the snacks, and we also looked at compliance in terms of were the things stocked in the machines compliant with the nutritional guidelines. And then we had 16 months of monthly sales data that let us look at the sales by machine, by item, and by park location. Okay. And I'll just mention the all the data we collected except for the sales data were at a sample of 10 parks. The sales data are data from every machine that was deployed. Okay. I want to get right into the findings. In terms of the acceptance of the healthier snack vending, which we were very curious about because one of the big arguments against it is that people don't want it, right? So we asked staff and patrons what they thought about the healthier snack vending items. And 88% of the patrons liked the items. And those who didn't, the major reason they gave for not liking the items were that they weren't healthy enough. 98% of those patrons said they would buy that snack again. And all the park staff who had tried the items, which were 8 out of 9, liked them. So very positive in terms of how acceptable these changes were. Buying behaviors, we learned that most of the purchases were made by or for children. So we understand this vending context to be more child-centered, and that people were eating the purchases on site at the park. Okay. All right, so the sales question, I think that's really where a lot of people are interested in learning what we learned. And we found something that surprised us, which was that sales increased over time. And here we looked at the sales volume by machine, right? And so if you look at this chart, you'll see we started in June 2011, averaging about $84 per month per machine. And we ended our data collection in August of 2012, and you can see we're up to $371 per machine. So an enormous increase, quadrupled. And then the other thing to note on this slide is the blue line just tracks how many machines were deployed at that point in time. So when we started collecting data in June 2011, there were 7 machines in the Park District field houses. When we completed the data collection in August 2012, there were 98 machines. But the story this graph tells us that there was an enormous increase in sales over time. And then when we looked at the sales in context, we found more positive news. We found out that this level of sales surpassed the industry average for machines that are located in what they call average locations, and that really has to do with the amount of foot traffic that they see. That the sales volume surpassed both what the vendor and park district had expected to do, so both partners were well pleased. We found that the top selling items were varied by location. And we think that has to do with the community characteristics of the parks are in. And that we found that the items that were the biggest sellers were traditional vending machine items, things like baked chips and fruit snacks. So we also did find that there were compliance issues, that we identified non-compliant items that were being stocked. We documented that when we did the machine audits. We found 54 instances in 31 machines. Wasn't bad, but there were instances of non-compliance. We also found restocking issues, and they varied greatly by park, and at times they're much higher than the national average. So you see, especially in the beginning, the restocking was not done on a regular basis. And we think that it could have affected sales, that at least initially that the restocking wasn't done on a regular basis. So if you see this chart, the blue line is the national average, the percent of stockouts at refill, and the green line is what we found. So we think that the non-compliance, i.e. the lack of restocking, did affect sales, and that it may be related to higher demand for snack foods in the summer, because the Chicago Park District runs day camps for children in Chicago during the summer, and there's more of a high volume then. Okay. We also found that the vendor initiated remedies to deal with noncompliance. They did training of the drivers on what foods met the guidelines and what didn't. They had found a SKU mislabeling of some foods, so some foods that weren't compliant registered as compliant products when they were scanned, but they corrected that. And then they also put in a strategy that was very useful, where they pre-packed boxes for drivers to take out so they didn't have to make those decisions, which was very helpful. One interesting thing we learned during this process was that drivers are paid on commission of the machine sales, and so they were stocking things they thought would give them the biggest return, and they were not believers that healthy foods would sell. So some drivers would stock non-compliant items out of their own economic interest. So this pre-kitting strategy, where they put things in a box that then could just be loaded without any decision-making on the driver's part, was helpful in that. But when we went back and looked in October 2012, there was additional non-compliance observed after they put those other 3 strategies in, and that resulted in 3 drivers being fired for non-compliance. So I think in terms of lessons learned, we learned that the patrons and staff liked the healthier vending choices, that the sales volume was acceptable and grew over time, and that this is a snack vending environment that is mostly catering to children. So we learned that it works well in that environment to stock only healthier items. Okay. We also learned that there are compliance and operational issues that were experienced in the early phases of the contract, and that the longer term, the 5-year contract, was a plus in this regard because it gave the park district and the vendor time to build a relationship and work out the kinks. And I think going forward, a lot of those kinks are worked out now, and that it's expected to be rather smooth sailing. So that's all I have in terms of lessons learned and findings, but I do want to acknowledge all the support we got for doing this work. The Robert Wood Johnson Healthy Kids, Healthy Communities was very helpful in this. The Alliance for Research in Chicagoland Communities gave us a seed grant to conduct this work, this evaluation. We had a number of research assistants who were out in the park surveying patrons, collecting the vending data. And the Chicago Park District staff were fabulous in terms of their participation and partnership in this. And we also had an advisory team that really helped to guide what we were looking at. So that's all I have for today. Thank you.
Great, thank you. So we're going to open it up to questions in just a second, but I very briefly just wanted to note that also at CSPI, we have a fact sheet on tips for successful implementation. So strategies for how to implement healthy vending and other food procurement policies successfully, like pricing, placement, and promotion strategies, and other things like taste tests and whatnot that you can do to get people to purchase the healthier options. And, oops, it went to the beginning. And then I also just wanted to remind people that we're going to unmute the lines. In just a second. So if you don't want to talk right now, then you can mute your line and also just make sure that you're not going to have background noise. So if people have questions, they could go ahead and ask them, or I can read the ones that people have typed in.
Make sure to mute your line if you're not speaking. That would be great, because otherwise we'll get a lot of background noise on the line.
Julie, I know that you had a couple of questions. Did you want to go ahead and ask those?
Yeah, sure. And can we just, Katie, somebody, we're picking up some background noise on the line, so if you could please mute your line if you are not talking, that would be great. People asked about whether the recording would be posted. Could you just address that?
Yes, so the presentation will be sent out to everyone.
Okay, Justin Rauza, your line should be muted, I think. We're picking up some background noise from your line. And Nikki Milgram.
Julie, you can just go ahead and...
Okay, I'll ask a question. So I have a question for Dr. Mason. I was wondering, you had mentioned that it was the initiative was done through a contract and not a policy. I was wondering if there were any thoughts now about doing a policy now that there's been success.
There has been discussion about sort of how to make this change permanent, but for the time being, as I understand it, it will continue to be done through a contracting process.
Okay.
Part of that has to do with how policies are made by the Chicago Park District Board. Oh, I'd like to add another piece that I didn't talk about, which is this snack vending piece was so successful that the Park District began a healthy beverage contracting process, I think within the last year.
Oh, that's great. That was actually another question that I had. I was wondering if they were moving into beverages.
Great. Can I also just add another fallout from this piece is that the City of Chicago has done a healthier vending initiative in its city office spaces, and a lot of that was informed by the experience of the Park District. So it is kind of a spreading phenomena here in Chicago.
Another question that we've received is for Mary. Have they employed strategies to engage caregivers in their sodium reduction healthy eating initiatives for older adults?
That's a great question, and as far as I'm aware of, we have not. We've engaged them in our fall prevention activities, but we have not engaged them in our taste testing or food procurement activities. I think it's a great idea, and I think we should investigate how to do that.
So then there was another question for Mary Ann to the chat panel about what were the vending sales prior to the conversion to the 100% healthier standard?
So there's a little bit of a backstory here in that the data for vending sales prior to the conversion were not available, and for a number of reasons, but that actually is one of the reasons that led to the Park District wanting to enter into a new contract, that their provider wasn't providing the sales data for them. So unfortunately, those are lost and unavailable.
Okay. Well, and then related to that, somebody had asked about whether she could get a copy of the contract, and I'll say that contract is actually available publicly, and we can send that out through the listserv if people are interested in that. So please make sure you're signed up for the listserv, and we'll send it out through that.
Katie, and people can feel free to ask questions over the phone or continue to type them in, and we'll ask the questions for you. Another question that we received for Mary is, do you know the brands of some of the lower sodium soup bases and tomato products that you've switched to?
Oh,
And if
sorry.
not, you could always send them to us, and we could send it out.
Yes, I'm going to have to send them to you, Katie. But yeah, I can't recall. But they used all sorts of different tomato products. Were able to really make an impact on several different menu items. And the same thing with the soup bases. But off the top of my head, I can't recall what the actual products were.
And then for Dr. Mason, a question came in about, is there any thought about making the nutrition standards tougher for the next round of contracts, like using the Smart Snack standard because of the number of kids that are buying?
Yeah, I think that's a great question, and one of the criticisms of this has been that, yeah, it's healthier, but people can still get 500 calories worth of snacks out of one serving here, or one transaction, so it's not the healthiest. I have not been part of any discussions where they're talking about making things even healthier, so I don't know that, but I know that it had come up as an issue in discussions in the past.
And Mary, you talked about the fact that your town administrator just wanted to go ahead with the policy because of return on investment, even though there might be some initial costs. The costs that you were anticipating or were anticipating, were those more startup costs of just getting the recipes together and buying that initial software? Were the bulk of them those types of costs, or are they costs that continue year to year?
Katie, they were the costs associated with actual products and the anticipatory need for those products according to the standards. And I just wanted to add a comment about the brand name. The more popular brands, as we know from retail grocery, are more expensive in general, and this goes to the institution buying as well. So we were able to note that on several different occasions. And it does require, somebody to keep a close watch, because we've had a lot of instances where the vendor will substitute a product thinking, oh, this is sort of what will meet their standards, or sort of what, they're looking for. But you have to have kind of a watchdog or somebody who's really going to be able to scan in those products and know that, no, in fact, it doesn't, and call them out and get the correct one. So it's definitely a learning opportunity.
So, Dr. Mason, a question for you, if you know this, about how was the vendor selected for the Park District? Was it through an RFP process, and were there any issues with that?
Mm-hmm. It was selected through an RFP process. And in terms of issues, I would just say that there were probably fewer applicants due to the nutritional standards piece of this than other times.
And if people have questions also generally about the financial implication of these types of policies, they're free to ask those or make comments too. Another question for Mary. Are you working with your local hospitals on implementing nutrition standards in Broome County?
We actually provided one of the initial assessments to them, and we wanted to work directly with them, but we haven't yet. They seem to be already identifying and adopting standards for their patients. This is just one of the hospital institutions. However, we'd really like to work with them more to find out exactly how they're doing it, and then maybe provide that model to the other hospital institution in Broome County. They're certainly a willing partner. They're a champion in our locale, but they have really not been directly working with us.
Okay, and another question for Dr. Mason. We've got a lot of good questions. How many patrons were surveyed on the product acceptance, and how were they surveyed?
Off the top of my head, it's very close to 100. I can't remember the exact number, but very close to 100. And what we did was, in those sample parks we selected, in the sample parks, I should just say, were selected to be representative of the park district as a whole. So we tried for diversity in terms of the communities they were located in terms of race and ethnicity and income, as well as geographic diversity within the city. So the patrons were surveyed at the parks in the sample, and they were randomly selected by just people in the park and asking them had they purchased anything from the vending machine.
And Mary, people often say that by switching to healthier options, the consumers won't want to eat the products by having lower sodium soups by making those types of changes. Can you speak at all to how the meals were received in the senior centers and Meals on Wheels, the healthier meals, what the reception was?
Yes, certainly. Like I said in the beginning, we really involved them in taste testing the products that we wanted to infuse in the menu, and we did satisfaction surveys after, and they were as high as they ever have been, so they really were accepting of the products. When you're working with school children, it's best to include them on the taste testing, but not do, any other promotion, because that is the concept, that healthier food isn't going to taste good. Even my own kids told me to stay out of their cafeteria. So it's a challenge, but I think if you're involving the priority populations in the beginning and providing them with the opportunity to provide feedback, you're going to have menu items that they will accept.
And Mary, did you do similar evaluations with the senior meals, or were the evaluations more with children?
No, the senior meals. We did satisfaction surveys with the senior meal participants, and they were as high as they ever were.
Oh, great.
Yep.
So, Dr. Mason, this is kind of related to the question about the process of selecting the vendor in the RFP, and you'd mentioned that there were fewer, responses, and I was just wondering if you had any thoughts or recommendations based on this experience, like say if a park district was just kind of starting out on this process and putting together their RFP, the things that they could do to try to encourage or get vendors to participate. I know that's a tough, might be, I don't mean to put you on the spot, but I just thought maybe you might have some wisdom.
So you're looking for ideas about what they could do to encourage vendor participation?
Yes, yeah.
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 Well, one of the things they do in Chicago and probably most places is have an informational conference with vendors. So I think having a presentation that sort of demystifies what this is could be very helpful in that context. So many more vendors typically come to the conference to learn about the RFP opportunity than actually end up submitting. So having a welcoming and informative presentation there could be encouraging. I think also the things we've learned could be sharing some of the strategies that are successful in terms of vendors complying with this type of contract. So for example, the pre-kitting option I think could go a long way in helping vendors think about how they could do this within their vending system, within their business model. Those are the ideas that have come up so far from our work.
And
Great.
Mary, would individuals on the phone be able to access the food procurement assessment tool that you said that you used? Is there a link that they can go to, or could you send that to us so we can send it out to the listserv?
Yes, Katie, I certainly can send that. It's a document that we don't have on our web page, but I certainly can send it to you.
Great.
I have a couple of technical questions, I think, more for Dr. Mason. First of all, what did you mean when you talked about the average foot traffic for a vending machine? Do you know what is the average? What is the amount? And then you mentioned fruit snacks, and there was a question about whether what you meant by that. Were you referring to dried fruit or like a different product?
Mm-hmm. Okay, so the first question is foot traffic. Apparently, I've learned quite a bit about how the vending industry works, and apparently this idea of the extent of foot traffic in a vending machine location is a kind of a metric that vendors use to gauge the profitability of vending machines. So I did a little research into how vendors project profit for vending machines and was able to come up with that notion of what a projected income is or what projected sales are for an average location. In terms of what, the number of people walking by that are foot traffic for average location, I do not have that.
Okay.
I'm sure that exists within the vending literature, though. And then the second question, I'm sorry.
About fruit snacks.
Oh.
What were you referring to, dried fruit or something else?
Dried fruit is allowed because of it has a nutritional value, but I was talking more about those like they're almost like hardened Jell-O.
Yeah, kind of more the candy products.
Yeah, but they're quote unquote sweetened with juice, and their percent of sugar by volume meets the guidelines. So that is probably the most sugary thing that would be allowed under these standards.
Okay.
But dried fruit is allowed.
Well, it looks like we're at the end of our time. I just wanted to remind everyone again that we do have a food service guidelines listserv to go along with these calls so we can stay connected in between them. And again, if you want to get on that, you can send me an email. And our next call will be April 23rd from 3 to 4 Eastern, 12 to 1 Pacific time. Ashley or Julie, do you have any closing comments that you want to make before we get off the line?
Just want to thank everybody for joining us. And the topic for the next call, we'll be talking about Randolph-Sheppard issues. And so we know that there's a lot of interest and hope people will come back for that call.
So thank you again to our speakers and to Ashley and Julie for helping to put these calls on. And let's continue the conversation on the listserv. Thanks, everyone.
Thanks. Bye.
Thank you. Bye-bye.